Got a sore throat that just won't go away? Before you panic, or take the wrong medication, let's break down the real causes, the fastest ways to feel better, and the serious red flags you should never ignore. In the next few minutes, you'll learn exactly what doctors look for, and what you can do right now to protect yourself. Let's get started. Most sore throats are annoying, but good news. They usually get better on their own. That means, for the majority of adults, you don't need to run to the doctor every time your throat feels scratchy. But here's the catch. Sometimes a sore throat can signal something more serious. So how do you know when to seek medical care? Let's break it down. You should call a doctor or nurse if you have any of these red flag symptoms. A fever of 101 degrees Fahrenheit, or 38.4 degrees Celsius or higher. This could mean your body is fighting a significant infection. Severe throat pain that hits hard in the first 48 hours. Pain this intense isn't typical for a normal viral sore throat. Or if your throat pain just doesn't start to improve after 5 to 7 days. Sometimes lingering pain is a sign you need professional care. Paying attention to these warning signs can make a huge difference in your recovery and help prevent complications. Remember, it's better to be safe than sorry. Some sore throat symptoms aren't just uncomfortable, they can be life-threatening. If you notice any of these emergency red flags, don't wait. Call an ambulance. That's 911 in the US and Canada. Or go straight to the emergency room. Here's what to watch out for. If you're having trouble breathing, this is a serious sign that your airway could be blocked. If you're drooling because you can't swallow your own saliva, it means your throat may be dangerously swollen. Swelling of the neck or tongue is another urgent warning sign. This can make breathing and swallowing difficult. And if you cannot move your neck or have trouble opening your mouth, don't ignore it. This can indicate a severe infection that needs immediate attention. These symptoms are rare, but when they happen, every minute counts. If any of these apply to you or someone around you, get help immediately. Don't try to wait it out. Emergency care is essential. So, what actually causes a sore throat? In most cases, it's an infection. But not all infections are the same. There are two main types of germs that can trigger throat pain: viruses and bacteria. Let's start with viral sore throats. These are by far the most common. If your sore throat is caused by a virus, it usually comes with other mild symptoms, like a runny nose or cough, and most of the time, you don't even need to see a doctor. Your body can fight it off on its own. Now, bacterial sore throats are a little different. These may require medical care, especially if it's caused by a type of bacteria known as strep throat. But here's something surprising. Even though many people rush to a clinic for a sore throat, only about 1 in 10 adults who seek medical care actually have strep. So the takeaway: most sore throats are viral and self-limiting, but a small percentage are bacterial and may need treatment. That's why knowing the signs is so important. Stick around, because we'll break down exactly how to tell the difference next. So, how can you tell if your sore throat is caused by a virus or something more serious, like strep throat? Honestly, it can be tricky, but there are some clues you can look for. Let's start with viral sore throats. These are the most common, and they often come with other symptoms besides a sore throat. A runny nose, a stuffed-up chest or general congestion, itchy or red eyes, and a cough. If you notice these symptoms, it's most likely a viral infection. That means your body can usually fight it off on its own without antibiotics. Now, strep throat is different. People with strep usually do not have a cough, runny nose, or itchy eyes. But there are some warning signs to watch for. Severe throat pain, a fever over 100.4 degrees Fahrenheit, or 38 degrees Celsius. Swollen glands in the neck, and sometimes a rash. You might also have recently been in close contact with someone who had strep throat. The good news: doctors and nurses can confirm strep quickly with a simple throat swab. Yes, just a quick Q-tip along the back of your throat. This test checks for the bacteria that cause strep throat and tells your clinician if antibiotics are needed. Knowing these clues can help you decide when to rest at home and when to see a healthcare professional, which is key for faster recovery and preventing the spread to others. So, do you need antibiotics for your sore throat? The answer depends on the cause. First, let's talk about when you don't need them. If your sore throat is caused by a virus, and most sore throats are, antibiotics won't help at all. They won't shorten your illness, and they won't prevent complications. Taking them in this case can actually do more harm than good. Now, when should you get antibiotics? That's usually when your sore throat is caused by strep throat. In these cases, antibiotics are recommended. Even though many people with strep throat get better on their own, doctors often prescribe antibiotics for a few important reasons. They help prevent complications that can sometimes occur with strep infections. They can reduce symptoms faster, so you feel better sooner. And they help stop the spread of strep to family, friends, and co-workers. So, the key takeaway: antibiotics are not a cure-all. They're only helpful when bacteria, not viruses, are causing the problem. Knowing the difference is essential for your recovery and for protecting those around you. So, you've got a sore throat and just want some relief. What can you actually do to feel better? Let's go over the most effective options. First, over-the-counter pain medicines can help reduce throat pain and make swallowing easier. These are usually safe and work well for most adults. Next, you might be tempted to try throat sprays. Here's the truth: they aren't any more effective than simply sucking on cough drops or even candy. Sometimes, the simple tricks work just as well, and they're easier to keep on hand. Finally, a warm salt water gargle can be surprisingly soothing. Many people find that gargling a mixture of warm water and salt several times a day helps relieve soreness and reduces irritation in the throat. So remember, simple, safe, and easy remedies can make a big difference. And you don't always need prescription medications to start feeling better. One of the most common questions people have when they're sick is, when can I safely go back to work or school? Let's break it down. If you have strep throat, the rule of thumb is to wait at least 24 hours after starting antibiotics. By then, you're much less likely to spread the infection to coworkers, classmates, or friends. That first day of treatment is key for keeping others safe and stopping the spread. But if your sore throat is not caused by strep, maybe it's viral or just irritation, you can return as soon as you feel well enough. There's no need to stay home longer than necessary if your symptoms are improving and you feel up to it. The takeaway: listen to your body, follow the guidelines for strep, and always consider the safety of those around you. Prevention is always better than cure. And when it comes to sore throats, one of the simplest, most effective ways to protect yourself is washing your hands, often with soap and water. Hand washing isn't just a habit. It's one of the best ways to stop infections from spreading. Every time you touch your face, eat, or handle shared surfaces, germs can hitch a ride. And regular hand washing removes them before they make you sick. To get the full benefit, it's important to follow proper hand-washing steps. Wet your hands, use soap, scrub for at least 20 seconds. Yes, that's long enough to sing "Happy Birthday" twice. Then rinse and dry thoroughly. Doing this consistently can dramatically reduce your risk of illness, including sore throats. It's simple, it's effective, and it's something you can start doing right now to protect yourself and everyone around you. And that's everything you need to know about adult sore throats. From what causes them, to how to treat them, and the red flags you absolutely cannot ignore. Remember, most sore throats are harmless, but knowing when to seek medical care can make all the difference. Keep these tips in mind, protect yourself and those around you, and you'll be ready to tackle sore throats like a pro. If you found this video helpful, please hit that like button. It really helps others find this life-saving information. Share it widely with your friends, family, or anyone who could use these tips. Don't forget to subscribe and hit the notification bell so you never miss our easy-to-follow, practical health videos that keep you informed and empowered. Thanks for watching, stay healthy, and I will see you in the next video.